that so many women in my practice were feeling ill-prepared for perimenopause. And so I felt like we needed to get this information out. And I am humbled by how much interest there was. And I guess it just shows that we do have to talk about these things more. So that is why we are here. And so tonight I'm going to walk you through, um, give you some insight, hopefully, about perimenopause. So for myself, if anyone hasn't met me before, I'm a naturopathic doctor. I've been practicing for almost 13 years. And I work primarily with women going through perimenopause and the menopause transition. And my passion is to build conversation and community for women in midlife so that they feel empowered and informed of what's going on. Just in case no one knows what a naturopathic doctor is. I did 8 years of post-secondary education, and my practice is patient-centered with personalized plans for each patient. We take a holistic view of treating the whole. But it's also important to mention that I am also a menopause certified practitioner. So the Menopause Society used to be called NAMS. This is the North American Society that regulates menopause practitioners. Essentially, that means that I studied a bunch and I took a test and I passed the test, and I have to stay on top of the up-to-date research in menopausal care. There isn't a lot of practitioners who have done this, unfortunately. I actually hope for more. Right now, I'm the only practitioner who has this certification from Toronto to Ottawa, but we need more because it's a busy field. All right, so what do I want to talk about? I want to make sure that you leave tonight feeling like you know what perimenopause is. You know what to look out for, you know the signs and symptoms. I'm going to talk a little bit about blood work as well, because that's a confusing little piece. I want you to understand how your body is going to change during your perimenopause transition. And I'm going to be also making an announcement of something called the Perimenopause Plan, which is a course that I have been working on for a very long time, and I'll be presenting it tonight. Oh, someone is not muted. Ooh, you have, just make sure we're muted, because it's tricky for me to go through and find you. There, I think I got you. Okay, cool. All right. So what is perimenopause? So right off the bat, things are going to get a little bit confusing because we don't have a great definition of perimenopause, which is why I think sometimes women aren't getting great care in perimenopause, because it's a confusing time. The definition that I like about perimenopause is a decline in ovarian hormones, estrogen or progesterone, meaning like your ovaries are starting to make less estrogen and progesterone. I think that gives a big encompassing definition of what it is. But clinically, and also I should say more in the research, they define perimenopause as a change in menstruation by 7 days. And I know why they need this defined definition, but it doesn't work for a lot of women. A lot of women aren't menstruating because they have an IUD in, or they're on the pill, or a lot of women never had regular cycles and their cycles are all over the place forever. And a lot of women have symptoms of perimenopause before their period actually changes by 7 days, meaning it got 7 days longer or shorter. And so I think we have to broaden our definition of perimenopause so it actually encompasses all the people that it's impacting. Just so that we're on the same page, I also want to make sure people understand what menopause is. So menopause is 1 day in time, meaning when you have your last menstrual period, you have hit menopause. And when you hit menopause, but you don't know you're in menopause, I should say, until it's been a full year without your period. So menopause is kind of like the event that happened that you didn't know that happened until it's a year later. Everything past that day is considered postmenopausal. Okay, so that's really important to just get that lingo down. So like so many things in women's health, we need more research. So the research in perimenopause is lacking. We definitely need to have a lot more of an understanding. This is for women's health in general, but especially in perimenopause, we have so many unknowns. And this is actually going to come up as I kind of talk a little bit more. Even today in my practice, a woman was asking me about her estrogen levels and, what she should do with her hormone replacement because of her estrogen levels. And I had to tell her, like, we just don't know. We don't know in the research what to do. I can tell her clinically my advice, but we don't have solid research on giving her a solid answer. And, if you look at the research coming in the next 10 years, there's a lot of great research going to be coming for perimenopausal women, especially around progesterone in perimenopausal women, but we need to do better. We need more funding there. That's my soapbox there. All right, so let's talk about perimenopause. The first thing that I want you to know about it is that as young as 35, okay, you can start to have symptoms. And the first thing that happens is that your progesterone starts to go down. So this is really important because so many times women come into my practice and they've been told, you're too young for it to be perimenopause. It can't be. It's not. You're in your late 30s. There's no way that you're going through perimenopause. And I'm here to say that's not true. You can definitely have perimenopausal symptoms as young as 35. And the first thing that's going to go down is progesterone. We're going to go over this a lot more just to really make sure you understand what's happening. But progesterone is going to be the first thing to drop. And later we're going to see the estrogen start to change and drop. And we're going to talk more about that. The reason there's an O in front of the estrogen is this is from the British Medical Society. I think it's a great graph, but they do things a little bit differently there. Oh, and I gotcha. Okay, so let's go to the next slide. Oh, I should actually say one more point here. What I'm seeing a lot of my practice right now is women having their babies later in life. I had my last baby at 34. And so they're literally going from a postpartum experience, which is a very hormonally volatile experience, and they're rolling right into perimenopause. So that's a lot of hormonal fluctuation. And I see this quite often. And again, I think it's hard for women because they're being told that they're too young or it's probably not perimenopause, but it is very possible that that is what's going on if they're over the age of 35. All right. So just so we get on the same page, progesterone, what does that do? So progesterone is what maintains a pregnancy. It also plays a really important role for supporting your period, menses. It impacts mood positively and negatively. So we see that some women feel really great. It's an antidepressant. Progesterone makes them feel really good. But there is also women who they have too much progesterone. They don't feel good. They feel quite anxious. And so there is actually this individual response to high progesterone levels with women. It's anti-inflammatory and it impacts the brain and cognitive health. So you can start to imagine what can happen when we start to lose our progesterone early in perimenopause. We start to lose some of these benefits. Typically, low progesterone leads to irregular periods and heavier bleeding. Estrogen gets a bit of a bad rap. Like there's a lot of noise online about estrogen dominance and you have too much estrogen. And, so I tell women, like, you're going to miss her. You're going to miss your estrogen when she's gone. I think we have to be a little bit kinder to estrogen. So high and low levels can impact your menstrual period. It prepares your body for pregnancy. It's a major antioxidant, right? Estrogen keeps us young, right? And so when we lose that, and I'm not trying to be the bearer of bad news, I'm just keeping it real. When we lose estrogen, we see a significant change in our aging. And I see this with women, like when they go into menopause and they don't have they kind of lost all their estrogen, right? They talk to me about how their skin changes, right? And their bodies are changing. We see that their heart health changes. We see their bone health changes. We see that their they can see higher dementia rates or cognitive health changes. And that's because they lost this really key antioxidant, which is estrogen. So I just needed to give a shout out for estrogen because she gets a bad rap. Keep the bones strong. Estrogen also helps our muscles grow and keeps our muscles strong. It helps impacts mood and brain health. Low estrogen makes your menstrual cycle stop. High estrogen makes for heavy, clotty periods. All right. I wanted to also just talk about two other hormones because they also were on that graph and they're also changing testosterone. So there's a decline in testosterone from your mid-20s all the way until the end of your life. This is not anything to do actually with perimenopause and menopause. We don't see that testosterone drops more dramatically during this phase. But it does play a really key role in libido and maintaining bone and muscle health. There's a lot of conversation right now about testosterone in women in perimenopause and menopause. There is so little research on it. Even in Canada right now, we don't actually have a topical testosterone product that is certified for women, meaning that we're using androgel, which has been okayed by Health Canada for men, and we're using off-label prescriptions in women. So we need to do better in this world. I think there's a lot of women who could benefit from testosterone support, especially post-menopausally. But we need to get better research and better understanding of how to support them. Melatonin, I'm pretty sure everyone here has heard of melatonin before. So that's a hormone that's actually made by your pineal gland, and it helps regulate your sleep. There's a major decline in your melatonin levels between the ages of 40 to 44. I'm sure some of you are going, oh, okay, this is making sense, right? So not only are we losing progesterone, but we're also could be losing a little bit of melatonin in our early 40s, up to 41% decline, which is pretty significant. And this can be a major factor for sleep as well. I'm not here to prescribe, right? I'm not everyone's doctor, so I'm not here to say this is the amount of melatonin that you need to be taking. But I will say that there are some very heroic doses out there. Like, I'm seeing people come into my office taking 10, 20 milligrams of melatonin. You probably don't need that much. Like, a little bit goes a really long way. For myself, I take 0.5 milligrams of melatonin occasionally, not every night, and that's all I need to get into a sleep cycle. So I just felt like I should put that out there because people are taking huge doses of melatonin, and I'm not sure if it's serving them the way they think it is. Okay, so this is how I like to think about perimenopause. I like to think of it as two different transitions. We have early, and then we have late. And I like to think of them this way because the symptoms picture is very different in these two places. We have early, which again, 35, fair game, progesterone starts to decline. The periods can become a bit closer together, but not necessarily that happens. Flow can get heavier, cramping can get a bit more painful, and insomnia and anxiety are usually the first symptoms that a woman will report in early perimenopause. I sometimes see mid-cycle spotting as well. So women start to spot around when they ovulate. I also sometimes see spotting before their period. They get like this brown spotting before their period comes. All of this is a sign that the progesterone is dropping. It's lower. I really want you to understand that so that you can start thinking about what's happening for your body and thinking about if it could be a lower progesterone picture. Later in perimenopause, where we're really now looking at usually it's like a mid-40s, late 40s picture. Both progesterone and estrogen can be declining. The periods can get farther apart. Sometimes we skip a period, right? So we just don't get a period for a month, and then we get like a doozy of a period. Hot flashes and night sweats start. Vaginal dryness can become an issue. Mood changes are possible. This is usually more of a feeling of like they're trapped in PMS, right? There's also a feeling sometimes of depression, right? So early perimenopause can be anxiety, insomnia, and late perimenopause can be depression. I know I'm really selling this perimenopause experience right now. There's a lot going on, which is why I think it's such a disservice to women that we haven't been better informed, because there is so much happening in this period of time. And women sometimes are getting blindsided by it. And I think that, I think we can do better. I don't think we need to be surprised by all of this. Okay, so again, just to make sure we understand, I want everyone to be thinking about what's happening in their bodies. Early perimenopause, progesterone's dropping. Estrogen maybe hasn't changed, but you might be feeling some anxiety, some insomnia. Maybe those periods are getting heavier, maybe closer together. Maybe there's some mid-cycle spotting. Later, and look at that graph, right? Look what the estrogen is doing. It is all over the place, right? We have estrogen at some points are super high, and then we have points where estrogen is super low. This is a chaotic time. So what that means is that sometimes a woman in late perimenopause, her estrogen is the highest it's ever been her whole life at times. And then there's times where it completely nosedives. So 1 month, she's having symptoms of too much estrogen. Maybe that's irritability, PMS, heavy periods, breast tenderness. The next month, she's having symptoms of hot flashes, night sweats, vaginal dryness, because her estrogen completely tanked. This can all happen in the same month, right? Because it's so volatile. There's so much change happening during this time. Good times, I know. So there's so many symptoms that I talked about. I just wanted to do a little review for you. So irregular periods are a classic sign of perimenopause, but there's more. You can have hot flashes and night sweats. Mood changes are so common. I think very few women are going to get through perimenopause without their mood being impacted in some way. Vaginal dryness, they can have a lower libido. We usually see a decrease in fertility during this time. I should make a note that you can still get pregnant during perimenopause, though. So contraception is still a conversation, but it's just a lower likelihood. Brain fog, insomnia, aches, and pains. These are all really common symptoms. Everyone's going to have a different mix and personalized symptom picture. So a question that I get all the time. Angela, I'm in perimenopause, check my hormones. And I get it. They want the confirmation. They want to know. Usually women aren't being validated always in health appointments. They're kind of being told that it's not perimenopause, it's something else. And the hard part is that there is no blood work to confirm you're in perimenopause. It is a clinical diagnosis, which is very frustrating because we want the proof. We want there to be paperwork that we can go and say, look, I told you so, something is going on with me, and there's my blood work to prove it. And we don't have that. And that, I think, makes sometimes this experience hard for women because it's all based on their subjective experience. It's depending on what they're telling, right? And sometimes our healthcare system has a hard time trusting women and what they're telling them is happening to their bodies. And so they're not always getting the support that they need. So why is there no blood work? Because it's a mess of a hormonal time. And again, women come to see me and they're like, look, I had my blood work done and my estrogen is so high, I'm estrogen dominant. And I have to remind them, you were estrogen dominant that day. That day, your estrogen was really high. Tomorrow, it could be so different. Every cycle, your hormones are changing. It is chaos. So to test at any point doesn't actually have a lot of utility. It doesn't help me as a I'm not going to be able to say that word, as a doctor, support these patients because I know that the hormones are changing all the time. Testing it is just not going to give us any information that's going to actually be useful and change our plan. but I do order blood work. And I think you should still get some blood work. It's not that there is no blood work worth having. It's just not the blood work that usually you think. It's not your estrogen and your progesterone, because your estrogen and progesterone are moving around all over the place. What I do want to do is I want to check to make sure that the symptoms that this woman's having is because of perimenopause and we're not missing something else. Right now online, there is a lot of noise about perimenopause, and some of it's good. Like, I'm happy to see these conversations happening, but I think we're also like blaming everything on perimenopause. And then sometimes in the doctor's visit, we're not acknowledging it at all. So there's this really kind of big divide happening. And I'm probably somewhere in the middle. I think a lot of the symptoms you can be experiencing could be perimenopause, but there could be other things happening here for you. And you want to be clear in knowing that. I can't tell you how many times women have come to see me thinking that it's perimenopause and they are iron deficient. They have, because their periods are so heavy, they're bleeding they're these heavy, heavy periods. They have no iron. And so as soon as we get their iron up, their insomnia goes away, their anxiety gets better, their fatigue is better. So all these things that they thought were hormonal were actually because of a deficiency. So I always check iron. I do that with a CBC, a ferritin, and a TIBC. I also check vitamin D and B12. These are major deficiencies that will also lead to a lot of the symptoms of perimenopause. I call these my low-hanging fruit. These are so easy. These are easy to fix. I can get your iron up, I can get your D up, I can get your B12 up. It is way harder to navigate the hormonal picture. Let's do the easy stuff first. I also check thyroid because that could just be a whole separate hormonal condition happening. And I also always check cholesterol, inflammation, and blood sugar, because there is also major metabolic changes happening as these hormones are shifting. And you might be feeling that in your body. You might feel like your body composition is changing. I want to catch that early. I want to see, okay, where did your blood sugar start to go off? Where did your cholesterol start to go off? I want to see that way before you hit menopause. We know this is going to happen in menopause, but I want to see the very beginning signs of it so we can be really proactive. I am a proactive, preventative kind of girl. So I want to catch this all really early for you. Okay. So to recap, things that are happening in perimenopause, these are the things I want you to take home from this conversation. 1, perimenopause can start at 35. Don't let them tell you you're too young. For some women, it might be 45, but 35, fair game. Menstrual cycle changes are common, but not necessary. You could still be in perimenopause even if your cycle length hasn't changed dramatically. Muscle loss starts at 30, right? This is big. This is huge, right? 10% of our lean muscle mass is lost between the ages of 40 to 50. It is the most important decade of your life of where you need to protect your muscle. Poor sleep is really common, and we need to support you there. Mood change is common. You need support and a plan there. Libido change is common. We need to talk about that. It's a sensitive topic, but I talk about it with everyone. Change is coming, and we need to have a plan. We know these changes are happening, and I think we don't do a great job of supporting women and giving them a heads up of this is going to happen to your body. Let's be proactive and preventative. Let's build a plan to support you. We know what's going to happen. And we know that perimenopause is such a crucial window to help because you still have some progesterone and estrogen. It's not all gone yet. And so there's so much impact you can make in that window. And that brings me to my project that I've been working on forever, the perimenopause plan. So I've been working on this project. I've been thinking about this project for years. And it's exactly because of the conversations I've been having that I sit down with women and I see them when they're in their 50s, 55, they're gone through menopause, and they're like, I wish someone told me sooner. I wish I got a heads up. I wish I made some better plans for this. And it's not like we don't know these things are happening. We know that if you have ovaries, you are likely going to go through this experience. And I think that we need to do a better job of being proactive. And this is why I built this plan. I also built this plan because I'm turning 40 in 6 weeks. And this is my plan. I am right in the trenches with you. And this is how I plan to support myself because I know what's coming. I see it every day in my office. I know what's coming. And this is how I'm going to plan to support myself. So it's a 5-module course. This has all been recorded online, and it's going to guide you through the perimenopausal experience. It's going to be a deep dive. So module 1, we're going to talk about hormones. It's going to be a more comprehensive deep dive than what I've done here tonight. I'm going to have a whole module on nutrition and exercise. We got to change how we're eating. We got to change how we're exercising and move our bodies. This is the most impactful decade of your life to do that. We got to talk about sleep. We have a whole module on protecting your sleep, figuring out why it's going wrong, what you can do to make it better. You need to talk about mood, right? Like you want to have resources in place to help your mood because it will be impacted. 40% of women going through perimenopause report that they have depression. This is incredibly common and doesn't get talked about enough. And then I have a whole conversation of libido, sex, and vaginas. It is taboo, and I go there and I talk about all of the things. You have some libido, hopefully a little bit left, maybe in your 40s, but it's going to change in menopause. And there's so much we can do to keep that fire lit. So each module is going to be 30 to 45 minutes. It is a 6-month access to the course. You can go at your own pace. It's all been pre-recorded, and every module is going to come with resources and handouts to help you along. So because this is my first time launching it, I wanted to do some special things for the group that signed up for this webinar. So only for this group, you're going to be invited to a live Q&A session with me in the fall. So everyone who signs up, we're going to meet up again on Zoom, and we're going to just talk it out. We're going to see how everyone's doing. I hope the majority of you have gone through the course at that point, and then we will just talk about what we learned, what's been hard, our questions, what's going on for us. I really want to build a community conversation around this. The same thing's going to happen in a private Facebook group. Everyone who signs up is going to be invited there, where we can share podcasts and books and resources and memes and whatever else is going to help us support us through this journey. Again, just to kind of, because it's a launch and I wanted to make sure it had a really high value, I'm also going to be releasing a course on hormonal therapy where I do a deep dive into hormonal therapy, all the things that you need to know. Everyone who signs up for this course, and again, this is only for the people who signed up for this webinar, you will get that course for free. Right, so that course is going to come out in early summer, and you are going to get access to that course for free. That course is a $200 value by itself. And then we also have partnered with a life coach. Her name is Jennifer Dawson. She's going to come on this call in a second. And the first 20 people who sign up with her will have an opportunity to work with her at a special rate. So if you're really looking for that one-on-one support to move through this course material, Jennifer is going to be there to support you through this. So the total cost of the course is $198. That includes tax. And again, that's including all of the things I just talked about, but it's only for this group here. So that is a special offer for everyone. Jen, if you want to turn your video on. Let's see. You can see.
We are good to go.
Oh, hi. All right, I'm going to do, there you go. Take the floor, Jen. Introduce yourself.
Well, I have to say, I was getting a little bit emotional seeing this whole display of women showing up for themselves. It gives me great hope for women's health. So, if nothing else, I congratulate you on that. My name is Jennifer Dawson. I am a fellow perimenopause learner and warrior. Some days I do better at being a learner, and some days I do better at being a warrior. I am a mother to a 10-year-old human and a 4-year-old chocolate lab named Arthur. I have over 20 years experience working in the corporate and government sector. I have various roles, including corporate social responsibility executive, lead account manager, executive and admin assistant. And all throughout this journey, what really came to the surface for me was this joy and passion in individual resiliency. So I decided to become a life coach. I'm a certified, associate certified life coach through the International Coaching Federation. What that means for my clients is that I abide by a code of conduct. I have to do education and training for my recertification every 3 years. And this was really important to me to be able to provide that confidence to my clients. I'm really passionate about supporting women who are navigating change that is impacting their well-being, their relationships, and their daily lives. I mean, show of hands or annotations, who thinks perimenopause falls in that group? Also, I have a really strong why. My why for pursuing coaching and supporting women navigating through these changes is that I've witnessed way too many people I've loved have their life hourglass run out before they've stepped into the life that they want to lead. So I want you to have your life cake and eat it too and leave nothing on the table. So what is coaching? Just to clarify very quickly, coaching is partnering with a professional who's been trained in methodologies to help you expand new ways of thinking and being. The type of coaching I practice is grounded in neuroscience, and it helps you remap how to show up and how to think about things differently. We're very forward focused, it's positive and goal oriented, and you are always in the center of the conversation. It is very client centered. You're the subject matter expert on your life. So if you just go back one slide, Angela, sorry.
My bad.
What some of the benefits, you may be asking, what are the benefits in bringing a coach into this stage of my life? And some of the benefits and values that I know my clients have talked about is this understanding that you're not alone and your experience is manageable and valid. We create these personalized, co-created solutions that are proactive to help you manage your symptoms and your health. Your quality of life will change as you're reducing your symptoms and balancing your life. You'll feel empowered to take control of your health and well-being while looking at your life holistically. We'll look at your physical, your emotional, and your lifestyle needs. And finally, by introducing these new habits and these routines, this will benefit you well beyond this period, pun intended, in your life. Next slide, please. So what if this is how we felt about this journey? And I want to further ignite your journey. So as an incentive, everyone who's attended the session this evening or signed up, so if you are seeing this as a recording, you are eligible for this as well. You'll receive one complimentary mini coaching session on me. If you're interested, you're welcome to email me at that address, or when you purchase your learnings, please do click that you give consent for me to contact you. And for the first 20 who are signing up, and I'm going to incentivize you to learn more about this amazing transformation that your body is coordinating for you. The first session will be $75. That's over 50% off of what the regular rate is. And there'll be a 10% discount on any packages purchased throughout the duration of the course.
Thanks, Jen. That's great. So good. Yay. So this offer for the course is going to be available until June 30th. Again, all this, I'm not going to be making any of this public right now. I'm just kind of leaving it to this group that signed up. If you have any other questions about the course, you're welcome to email me. Of course, I'm happy to answer any questions. But even if you don't take the course, I hope tonight was still valuable. I hope you still felt like you got more understanding of what's going on during this period of time, because there's a lot going on. And I really do think that if we have the knowledge and we can make a proactive plan, I think we can navigate it a lot easier.